and thanks for joining us on another episode of Health Options, the program that not only tracks government policies on health, but helps you with the information you need to make informed choices about your health. Welcome to the program. I am Rabi Abdullah. The modern era of cancer diagnostic and treatment is constantly evolving with new breakthroughs and discoveries, changing the course of care at a rapid pace. Find out what those innovations are all about on this episode of Health Options. Cancer remains a major source of morbidity and mortality globally. The World Health Organization says that an estimated 166,000 cases of cancer was recorded in Nigeria in 2018, out of which 41,000 of the patients died. Experts identify tobacco use, alcohol consumption, sedentary lifestyle, polluted environments and unhealthy lifestyles as the key drivers of the deadly disease in Nigeria and most African countries. The goal of the federal government is to, among other things, make screening services and early detection of cancer available for all Nigerians, as well as improve access to quality, cost-effective and equitable diagnostic and treatment services for cancer care. The cost of cancer care is, however, one that requires support from wherever possible, as government and individuals can't bear it alone. We have non-governmental and non-profitable organizations lending support in that regard, and we have one of such which has the wife of a state governor using her expertise and position in the society to make a difference in the country's efforts at dealing with cancer burden among the populace. You will get to meet my guest shortly. This is Health Options, and as we discuss cancer care and support in Nigeria, I have the wife of the Kebbi State Governor and founder Medicaid Cancer Foundation, Dr. Zainab Shinkafi-Bagudu, as my guest. Nice to have you join us on Health Options again, Dr.
It's nice
Zainab.
to be here once more, Hajarabi. Thank you. Thank you. Well done for the work that you do in health.
Thank you. Thank you. You know, a lot had happened since the last time we got talking about cancer, the coronavirus, pandemic set in, change the face of everything, change the face of the way I was even wondering how we're going to go about something I know to be a tradition for you, for your foundation, talking about the annual cancer walk. But somehow I'm sure you're still talking, working towards it. Of course, taking into cognizance the safety measures on ground.
Yes.
Okay, so while we will await that, let's go straight to the point now. The mention of cancer. Cancer remains a public health burden that it's a global one, and I don't think there's any country that could say they've really tackled cancer within its domain completely. Let's start with the Nigerian situation that we keep talking about. Are we making improvement? What is it like out there as we speak?
Well, it's a very good question. Thank you for it. First of all, there are countries. No country can say they don't have cancer. It's a situation that will never happen. Because diseases are part of the continuum of life. You are well, you're sick, there is death, and that is how life is. But there are countries that are better off than others. And there are some countries that are on the path to eliminating some cancers, very close. For instance, cervical cancer. For instance, Australia. We also have an African country, Rwanda, that is almost going to be probably going to be one of the first countries to eliminate cervical cancer. We'll come to that. But for Nigeria, I think we have made a lot of improvement. We talk about it more. The awareness is definitely much higher. Some see it as positive, some see it as negative. I see it as 100% positive. The fact that we're talking about it means that it is positive, because what you know is not going to kill you. The more we know about it, the more, like you rightly said, all the things that you enumerated in your introduction have to do with lifestyle, tobacco, lack of exercise, the kind of food that we eat. All these things are within our reach and things that we can easily do something about. And it helps not just cancer, but so many other diseases. So if we can educate people right from the grassroots to any echelon of society, then we have done a lot. If we put that aside, people don't see advocacy and awareness as an important bit. But for us in low middle income countries like Nigeria, it is the biggest low-hanging fruits that we have, and one that we have taken into cognizance in the last 10 years. Again, a lot of non-governmentals have been actively involved in creating this awareness, like us, the Medicaid Cancer Foundation, and so many others all over the country, doing a lot of good work. The other good thing about the NGOs and civil societies is that they are coming together, we are coming together, I should say, and forming coalitions. And these coalitions have stronger voices that speak more and can influence policy and can help people more. If I come and say, oh, Hajarabi, give me 10,000 naira, I want to help patients. But if I come with 5 other governors' wives, you say, these people are serious, so let me give them their 10,000, let them go. So it helps. We have a coalition, First Ladies Against Cancer. We have the CSOs against cervical cancer. There's so many that are coming together now and are speaking up and working. And then in terms of facilities that are available, this is also coming up, both in the private and the government sector. The spectrum from awareness, screening and diagnosis to treatment is being covered. You mentioned COVID-19. With the COVID-19, there has been a lot of stimulation in our healthcare sector in Nigeria. It was seen as a negative thing, an infection that came to infect everybody. The whole world suffered from an unprecedented interruption. But there is a positive side to it. It helped to grow our health system in terms of infrastructure. So many isolation centers went up. Some of them were temporary, but there were also permanent fixtures. These centers were not built empty. They were equipped. These equipments are going to help strengthen our healthcare system. A lot of machines were bought. We all heard about the PCR machines. Initially, if you remember that map where only some states had it, and then as we went along, the NCDC did a beautiful job, and it just kept growing, and now it's all green. All the states of Nigeria have got a PCR machine. That PCR machine is not only used for diagnosing COVID-19 coronavirus, is used for diagnosing many other viruses, including human papilloma virus, which, as we all know, is the cause of cervical cancer, which is the second commonest cancer in Nigeria.
Okay.
So that's fantastic. And then also the treatment centers are more. We have 14 comprehensive treatment centers in Nigeria today. It's not as much as we would like for our population, but it's coming up. It's coming up, and we have to be positive. The world out there listens to us more. We have more international positions where we can go and make our case. So it's not as bad.
Okay.
So we thank God.
Well, good to hear that. And would you say, while you are using your position as the wife of the governor, as a medical expert to make a difference, would you say Nigerians are really forthcoming when you look at the fact that cancer is a very, very expensive, disease to treat?
Very.
Are Nigerians being their brother's keepers the way they should be?
Okay. Cancer is very complicated, not fully understood, and expensive. There's no doubt about that. No matter how rich you are, cancer can make you a very poor, indigent person after a year or so of treatments. That is the reality of cancer. And the opportunities and partnerships in accessing care and treatments is not so much. A round of chemotherapy costs 600,000 naira at the National Hospital. How many people can afford that? Even one round. Now, coming to the charity aspect, you see, one thing about advocacy is that you grow. I have grown. Maybe if you look at my tapes from 2, 3, maybe 5 years ago, my answer to that would have been no. We're not charitable. Okay. We don't exactly as you put it. But now, from where I'm sitting, we're not doing badly, honestly. We have that spirit of giving in us. We are charitable people. There is giving in every aspect of our lives. It is just not structured. The societies that you're talking about, the foreign high-income countries, they have their organized, structured charities that give to cancer. Cancer UK, Cancer McCabe Society in Australia, everywhere there are thousands of them, and they give in a structured way. You have your salary every month, they take away, you decide and you sign a form, direct debit, and you give $10, £10 to your preferred charity. However, you and I sitting here and everybody in this studio is funding much more than that, one way or the other. There are people in your homes, there are people in your village, there are people in your mother's house that you are either feeding or sending to school or you're treating. Every day you will get a phone call on different levels. I might get a call to fund 600,000 chemotherapy, but I am sure that in every week, you, Haji Arabi, will get at least one phone call for assistance, and you will give.
More than that.
You will give, exactly. You will give within your own sphere. So how can we say we're not charitable? Altruistic giving is a part of our lives, of the African society. It's a part of our life, but it is just not structured or captured into our health finances system.
Okay.
And that's why we don't see the effect of it.
Okay, for someone that I could get her perspective from two sides, the fact that you're the wife of a governor and the fact that you're a medical doctor, how would you describe, where we are in terms of the intervention now? You've enumerated a whole lot of things that government had put in place. What are the gaps you really want to see closed?
Well, I think I also mentioned them, and it's very simple, really. My dream would be a Nigeria where cancer patients, the prevalence reduces. How will we reduce that? By having a screening system in place, by including it in our curriculum, teaching our children more about it, calling out to women and men at a certain age that you're of this age, come and get your prostate cancer screening. As soon as it's beyond...
That's for boys, for the
men,
male folk,
yes, for prostate cancer. This is the commonest cancer in men. And the outcomes are poor because we only see it in the later stages. But if we catch it earlier, then the treatment is more successful and it's also much cheaper. So I would like to see a national screening program in place where everybody gets, for a certain age, you get a message on your telephone, you get a message in your email, you can walk into a health center and be screened for breast. If there's a lump, you go to a center, they test it, it's cancer, it's not cancer. Same thing for cervical cancer, same thing for the prostate cancer, at least the commonest ones, and pediatric cancers. And then for where screening is available. And then, of course, reducing the cost of treatments. Access to care. These treatment centers are very difficult to get to for most of our people. Sometimes you're living in Kebbi and the only machine working is in Lagos. You can imagine the burden on a sick family, a family that maybe they've never been to Lagos, and they go to the hospital in Kebbi and they tell them, oh, go to Lagos or go to Benin. That's the place you will get the machine. They struggle, they get this money, and they have to go and live there. So bringing it closer and closer to the doorstep of everybody. And the primary healthcare system is very vital in doing this. They cannot provide such high-level care, but from the primary healthcare, we can talk about the awareness, the education, and the screening, even up to diagnosis. And then the treatment can be left to all our tertiary, the universities, and the higher hospitals in all the states. So reducing the cost of care. To do that, we need to look at public-private sector partnership. The government working with the private sector. It was done with HIV, so why can't we do it with cancer?
Exactly. I'm just wondering what the NHIS is doing in that regard at the moment.
NHIS is doing a lot of work. Maybe when we met last year, cancer care was totally zero under the NHIS. However, under the leadership of Professor Sambo, the new ES that was appointed, there has been lots of shifting. And now, and we've been advocating and pushing for policy change, cancer care is now accessible under the NHIS, from diagnosis to treatment. It's not ideal, but it is there. And then when we say NHIS, don't forget that not all Nigerians are covered in NHIS. Most Nigerians are in the informal sector. So how do they access NHIS? Also, the contributions differ from state to state, and depending on the structure of that state, you can imagine the pot of funding of the health insurance system in Lagos State, where there are more corporate workers. They work and they put in their contribution to the health system, compared to a state like Kano, where they're traders and they're not formal workers. Nobody is taking out their money, but they have more resources. So to pull that fund into our health insurance system, we need to look at how to balance that. And then not to talk of our own agronomic states like Kebbi, where they're just rural farmers, and we've had such successful farmers, but nobody is taxing them, and then it's not put into our health insurance system. So they're doing some work, but it's just not equal and balanced. And unfortunately, the laws of Nigeria as a federation, you know, it's that's the way it dictates it.
They have an act that still needs to be amended. The NHIS act that we are still expecting the National Assembly to amend. Earlier on, you mentioned what countries like such as Australia and Rwanda had done with cervical cancer. And at some point, I had the Executive Director, National Primary Healthcare Development Agency, on this program, and he made mention of how close we are to getting the human papillomavirus vaccine.
Oh, fantastic.
So
I'm glad he said it on, he said it on TV.
He did. So what's your take on that?
Yes, like the ED rightly said, Nigeria has been long to start that vaccination, and it is a vaccination that can save our women and children from having cervical cancer. There was a call by the WHO in 2018, of which Nigeria was the only country that signed up to that call, to eliminate cervical cancer by screening, diagnosing, and treatment. And the vaccine is the very key part of that elimination plan. The call to action went out, and I think on the 17th of November, the next month, there's going to be a global launch of the whole thing. It's already been adopted. It's good to have these things because it gives more publicity, and the countries and everybody is involved. And Nigeria is fully involved, like you heard from the ED. And the NPHCDA has also decided to start giving the human papilloma virus next year. We're not sure when. With the disruptions caused by COVID, there might be a delay, but we've been promised that it will start next year. We agree it's expensive, it's not available, but Nigerians women deserve the chance to live as well. And we have the resources to be able to co-fund this vaccine, and it's available. Just like polio was eliminated, there's no reason why we can't eliminate cervical cancer. So we're really glad and we're happy.
Okay, for Nigerians out there, especially cancer patients who might want to reach out to your foundation, how accessible is your foundation?
It's accessible, but I must tell you that it's inundated. We are grateful to our sponsors and people that help us to help others. We have built a reputation of credibility over the last 12 years that we have been in existence. So we reach out to people, we access grants so that we can help indigent Nigerian patients. But like I said, cancer is extremely expensive. You find a grant of 10 million naira, and I just mentioned to you that a round of chemotherapy of radiotherapy is 600,000. So how many are we going to help? 10.
Is it 60,000 or 600?
600,000.
Wow.
And then chemotherapy on its own, it's also within that range. You have 300, 400,000 per cycle of chemotherapy.
I didn't know it had risen that much.
Well, if you remember, we had quite a lot of machines before, but they all went bad because of poor maintenance, and maybe the costs that they were giving it is too low. The same thing in the Nigerian Sovereign Wealth Insurance Investment Authority has done that partnership with the University of Lagos, and that's a very good example. We hope they can do it all over the country, and that will bring down the costs, hopefully. So we have fundraisers, of which, like you mentioned, the work that we do in October is our major fundraiser every year. We're on social media, we have a website, you can go, you can send a message, you send your report, our doctors look at it and they grade how helpful it is.
Well, maybe just give your parting shot to Nigeria on a preventive note now.
Yes, well, I hope that we will all learn that cancer is a very deadly disease. However, we can preempt the deadliness of this disease by educating ourselves and our children, our spouses, everybody around us with the warning signs, what to look out for, and living a very healthy lifestyle. Because the earlier we detect it, the better the chances of beating it. The more we start to detect early, the more Nigeria will join the leagues of high-income countries like America and the United Kingdom and Australia, and we can all be happy and be healthy.
Thank you so much, Your Excellency, for joining us again on Health Options and sharing your thoughts with us.
Thank you very much for having me. It's been a pleasure.
Up next is our complimentary segment, and today we bring you the innovations in cancer diagnostic and treatment.
It's been established that 90% of the causes of cancer is due to environmental factors and our lifestyle. Only 5% is actually genetic, is due to genetic predisposition. And that 5% even has to be manifested, and it is triggered by the environmental factors as well as our lifestyle. Now, a lot has been done by way of diagnosis in the past. What we used to do mostly like MRI and X-rays and things like that, they were based on the anatomy. That is to say that the cancer has to develop to a certain size before the diagnostic equipment will pick it up. But today, we have, due to molecular advances and genomics and proteomics, we have innovations, non-invasive techniques that exposes us to less radiations that you can even predict. Not only diagnose that you have cancer, but you can predict that you are likely to have cancer down the line in the next 10 years. Some of those tools include, tomography. Tomography is what we call the test of physiology. Test of physiology is based on heat detection. We've come to understand all about disease is about exacerbated inflammation. So areas of inflammation, the tomography can pick it out and be interpreted by, experts. Take, for example, as I say, tomography can pick cancer 10 years earlier than what mammography would pick. That is one diagnostic tool that we have, and I'm happy to announce that we have it here in our center at In-Country Medicare in Abuja. We also have what we call the DNA testing. The DNA testing, we've just acquired it, 2 weeks ago, is actually a robust test that actually takes care and diagnoses the risk of even developing, that your genetic composition can predispose you to coming down with, cancer. Another tool that we have is also based on biofeedback. That is our UNDAMED. UNDAMED is it's a very powerful diagnostic and treatment tool that we use in energy, medicine. UNDAMED goes in and it works based on detecting electromagnetic, frequencies and the amplitude that changes. Using the radial pulsation, you are able to scan the body, and then UNDAMED will pick trouble spot areas. And once it picks those areas, it will even diagnose and tell you the condition. From the urine, we can test your risk of developing cancer even in 2 years' time. It is based on a particular hormone, that is the pregnancy hormone, known as the human chorion gonadotropic hormone. You can use it for both routine checkup and also for, assessment of, the response that you are giving to your patients in terms of, treatment. So all the tests that I have mentioned, it is only UNDAMED that actually diagnoses and treats at the same time. Yeah, UNDAMED does that. But the other tests that I have mentioned, that we all have them available here, they will just give you the results and tell you where you are. in your cancer status.
And that does it on this episode of Health Options. Practice healthy living and keep safe. A quick reminder also that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Thanks for watching. Hope to see you again.
Issues in the sports sector remain one of the most debated among Nigerians due to the passion, followership, government involvement, impact on Nigeria's external image and our national life in the sports parliament. The NTA offers Nigerians deep views on issues with experts in the sports sector, offering in-depth analysis, hindsight, insight and foresight towards elevating Nigerian sports to the zenith on the floor of the sports parliament. Sports Parliament, a unique platform for sports discussions, showing live on the NTA. Keep a date with the parliamentarians.
The eyes have it.